Welcome to ASA Central Line, the official podcast series of the American Society of Anesthesiologists, edited by Dr. Adam Stryker.
Hello and welcome to Central Line. I'm Dr. Brooke Trainer, your host for this episode on mentorship and wellness. Today's episode is the first in a three-part series this year focused on mentorship. And we're starting by exploring its powerful and sometimes underappreciated relationship with physician wellness. Today, I have Dr. Vanessa Henke here with me from the ASA's Ad Hoc Committee on Mentorship. And I'm really looking forward to talking with you about the connection between mentorship and wellness. So let's go ahead and dive into this first topic. Dr. Henke, you've never been on the show before, so if you don't mind, please just introduce to the listeners who you are, where you're from, a little bit of background, and your involvement with the mentorship work.
Thank you. I am currently an associate professor at UCLA in the Department of Anesthesia. I'm originally from New York, and I went to medical school, college at Harvard, and went to Mass General Hospital for residency, which was a wonderful experience. Went on to do ICU fellowship at Stanford, cardiac anesthesia fellowship at UCLA, and I recently moved to UCLA. I had been practicing at UCSF for several years. I was a member of the Ad Hoc Committee on Mentorship, and I'm also a member of the Committee on Young Physicians. I'm also strongly involved in the California Society of Anesthesiologists in various capacities and in various ways that have to do with helping earlier career and in training members.
So it sounds like, Dr. Henke, you have a lot of experience in the mentorship work that you're doing. And so to get things started, you want to tell us a little bit about your involvement with the committee?
Sure. I am a member of the Committee on Young Physicians, and I became a representative from that committee to the Ad Hoc Committee on Mentorship, which was a time-limited committee that ASA created in order to develop what we have now and want to let everybody know about, which is the mentoring program.
So how is it that you got involved with the ASA Ad Hoc Committee on Mentorship?
Well, mentorship is something that's always been really valuable and important to me as both a mentor and a mentee. So as a member of the Committee on Young Physicians, I knew that there was an ASA mentorship program. It's something that I participated in. It's really rewarding to serve as a mentor, and I'd encourage everyone to do that. And the mentorship program really started to develop in 2021. ASA surveyed members and realized that younger members, both in training and early career, are looking for mentors, especially near-peer mentors. And so ASA first developed a medical student mentoring program, a near-peer program that launched in 2023. Participants were really happy with it. And then as ASA was working to expand to what we have now, which is a mentorship program to support all levels of mentees, I got involved in helping build that out. It's a committee that's had many really great leaders, and I really just want to get the word out that this is something that we can all participate in, whether as mentors or mentees.
And things are going well, it seems like.
Yes. First, I just wanted to mention that the way to get involved in this program and learn more about it is just going to the ASA website, asahq.org/mentoring. And there we've put a lot of resources for both mentors and mentees. How to select a mentor. You basically use the website. You can search based on people's name or based on a geographical region, an area of practice, a specific interest that you have, aspects of your background that are important to you. And then as a prospective mentee, you can click on a person, and then the website will send an email out to that person, and then it connects you. And if you are, as a mentee, are looking for a certain time frame, it'll only match you with people who are interested in serving as mentors during that time frame. And then you can reach out to that mentor through the ASA website. And then it's really up to the two of you to schedule meetings, decide how you want to have the mentorship. You know, if it's somebody local, would you be meeting in person? But it's also very easy to find someone across the country and then do things via Zoom or phone, whatever works for you. And people have found that it's really useful. And certainly as a mentor, it's incredibly gratifying to help people to develop a relationship. And then an important part of the program is that there's an endpoint. So, this is going to be 3 months or this might be a year, but you can make the really good use of that time, knowing how long the relationship is planned to last.
I'm just laughing inside because I'm so tickled the ASA created a matchmaking website. There's so many benefits to having a mentor and being a mentor. And so I just want to zoom in a little bit more on what you were speaking about. This is really cool. And I really want our audience to know about this so they can utilize these resources. So maybe you can sketch out the benefit of mentorship specifically for us, particularly being that a lot of the young physicians and residents coming out might be utilizing this heavily. So really maybe look at it from their point of view. What really is the benefit of mentorship to them?
Well, as we go through training, try to enter training, try to get into a residency, all the way to the point of being early career attendings and beyond, we're looking to develop personally and professionally. And you can really look at the relationship and identify what you want, because what if it's about leadership? What if it's about dealing with conflict or teaching people who are younger? There are all sorts of domains that mentorship can be really valuable in. And really, the boundaries of the relationship are what you develop within that mentor-mentee relationship. How often do you want to meet? It's something that really can help us all with professional growth. And I think among my colleagues, there are lots of people in leadership positions and even high leadership positions, and they have different kinds of mentors. You really just need to look at what's most important to you at whatever juncture of your career you're at and decide what kind of mentorship would be useful. And ASA is going to try to facilitate finding a mentor like that. Mentorship has certainly meant a lot to me, and we could talk about that later, but that's the general overview that I would say.
Yeah, and that's great. I think that you touched upon one aspect of mentorship that I think, anesthesiologists can all gain. You can all feel more connected to the specialty over time, but also anesthesiologists may not realize that being a mentor for someone can actually improve wellness for that person. It's a lot of stressors being an anesthesiologist. And I know there's been a lot of articles in the ASA Monitor that have talked about and highlighted burnout, early career attrition, leadership challenges. Do you think those conversations helped inform some of the structure of this mentorship program?
I think that everyone who's involved as a mentor and who's been involved in the development of this program is really passionate about creating connections through this program that attenuate that sense of burnout, that hopefully will prevent people from feeling burned out. But they can also, if you're approaching burnout, help get a person out of feeling the way they're feeling, to find new opportunities for growth, whether it's in their own institution or beyond. And I think that it certainly is an important aspect of wellness to network.
Yeah, wellness is at front of mind for many anesthesiologists, but the connection between mentorship and wellness isn't always explicit. So how can mentorship support wellness, maybe beyond career advice? And, how can the mentor help mitigate that isolation or feelings of imposter syndrome or, early career stress, things like that?
Yeah, I think that what's important to remember and what having a mentoring relationship can drive home is that we've all been in these same sorts of positions, setting out early in our careers in particular, but also dealing with the challenges of, for instance, maybe starting a family or moving across the country or being in a new institution or trying to become a leader outside of your institution. We all face the same insecurities. And if you can find someone with whom you really connect, who can bring a little bit of insight from their experience and their experience as a mentor to others, it makes us realize that, we're all in this together and people have been there before. So for me, some of the advice I've had from mentors over time has been really wonderful in terms of just making me understand that this is something we've all dealt with. Our struggles are not unique.
Absolutely. Now let's flip the lens. So how does serving as a mentor improve wellness for the mentor?
Well, my experience as a mentor have been really rejuvenating, just being able to connect with somebody who's at an earlier stage and have any positive impact on their trajectory or how they're feeling is incredibly rewarding. And just developing that relationship with them, helping them identify things that will help them feel better in the future about what they're accomplishing is really just intrinsically rewarding and one of the most wonderful things that I've been able to do in my career. Y'all get to take care of patients and help people work with others at our institutions, but getting to know someone in a totally different circumstance who's dealing with some of the same things that I've wondered or struggled with and helping them find the direction they want or just get some useful practical advice, it just makes me feel better at the end of every session and at the end of each relationship. It's incredibly heartwarming to be part of this process.
Yeah, I would agree. It's definitely a feel-good thing to be able to, lead behind your legacy. This is your legacy. You're leading and teaching, and you're a steward of that for that mentee. Yeah, I think it's a highly rewarding aspect of being able to help others pass on the torch. Are there any particular career stages? We talked a little bit about residents and students, but what about mid-career transitions that you think mentorship can have some impact in their wellness?
I think ASA has so many people who are later in their career who have a wealth of knowledge, people who I consider my mentors and people who want to give back and they actually have more free time and they have a lot of perspective. So I think it's an excellent time to seek mentorship, and ASA certainly has a lot of later career mentors who can help as we face the mid-career decisions that'll help determine the trajectory of our later careers.
I'm just curious, when folks go to visit the mentorship website, can they put in like career stages, age parameters? I mean, how matched up is this for folks on the website? If they want to find somebody who's maybe mid-career, late career to mentor them or for them to mentor. So how many qualifiers are there available?
So when you use the ASA mentorship website, you basically can identify yourself as anything from an international medical grad or med student, resident, or someone in their early career, their first 3 years, up to mid-career, 4 to 10 years, or 11 to 20 years, and then late career. And likewise, when you're searching for mentors, it'll link you up with appropriate people who are either near peer all the way up to late career. And then we offer on the website a huge selection of areas of interest, from all the things that would involve a fellowship out to physician wellness, point of care ultrasound, LGBTQ plus, leadership development. It really runs the gamut, and then covering various areas that would involve education, things like patient safety, women in anesthesiology. So you can really drill down and find a wide variety of mentors and rerun the search if you're looking for specific things. And in terms of focus of practice, all the different subspecialties, practice type setting, ethnicity, gender identity, and even things like couples match or research underrepresented minority in medicine. So there's a broad gamut of categories that you can select and then try to find a mentor who is looking for mentees with those interests. So you can find a wide variety of mentors.
Oh, that's great. You mentioned about your own experience with a mentor early on in your career. Would you like to talk about that as an example of how this can really work? And I'm curious to hear your story.
Well, my story, I'm mid-career at this point. So I've had such an incredible variety of mentors who've helped me in various ways. Professionally, I've become more involved in the ASA and the state society level. So people who've really helped me in that regard, subspecialty mentors. I've had just an incredible variety of mentors who've helped me at different points. And they're people I still value, even if we don't frequently keep in touch, we periodically keep in touch. And maybe the best advice that I have is to always keep an eye out. And going to meetings has been a really incredible way for me to meet people. And sometimes those people are just connectors and they don't actually have much in common, but they know someone through their professional involvements who they have linked me up with. And it's made such a difference in my sense of having a community within the field of anesthesia. Also, just having people who've given me invaluable advice.
That's right. I can't agree more. Those meetings are really where you can, put a face with a name, meet them, realize they're a breathing, living, normal human being, and it kind of normalizes and I think puts things into perspective like, oh, they're struggling just like I am. And I think those meetings are really great for connecting, like you said, and making those connections. Another thought that I had regarding mentorship and wellness was that many anesthesiologists usually seek mentorship when things aren't going so well. They're usually during periods of uncertainty or troubles. So, can you talk a little bit about how mentors can help normalize those struggles, while hopefully encouraging some growth for those folks?
Sure. I mean, I'm thinking back to the times when I've really looked for extensive amounts of advice. Obviously, when you're trying to get into a residency, trying to decide whether you want to do a fellowship or what kind of mode of practice, whether it be academics or private practice, those are times when you want to meet people from a broad variety of backgrounds and get some inside information. And then when you're looking to develop your career, those first few years are so important. How do you go to your first job and make a good first impression? What are the important things that you may not have thought of? How do you deal with just the general challenges of independent practice when you're no longer in training? Of course, when you're preparing for all these exams, but then once you do get a foothold in your first job, maybe you're thinking about switching jobs or how you can rise within your institution. And I think the benefit of having extramural mentors is that unlike most of your peers, they're a little bit further ahead in their training. And it's not the same as asking your boss for the advice, because maybe there are things you might be reluctant to ask of a boss. But if you have a mentor, they have leadership experience, they understand these questions, and there's somebody outside of your system who you can get meaningful advice from. So I think knowing that you have people to talk to outside of your own institution in and of itself creates a sense of wellness, because maybe there are certain things you don't want to discuss, or maybe you'd rather discuss them with somebody with whom you have a better sense of identification in terms of your background or your research interests or your leadership interests. Maybe you want to talk to somebody with an MBA and nobody at your institution has one. So I think it can be really inspiring to meet people who are a little bit further along on their path and can give insight that you really can't get anywhere else up close, because maybe nobody shares that specific set of interests that you do where you are.
Yeah, I agree completely. It's great to have outside resources, but I also think, and this is, something I'd love to have your perspective on, mentorship just isn't outside one-on-one relationship. It can be a culture within your own department, within your own institution, like a
Absolutely.
culture, yeah, of strong mentorship. What does that look like if, we were to look at the ideal program or how that could work within someone's own institution or own department or professional society, if I may? What would that look like?
Well, my experience is in academics, so I'll speak first to that because that's really what I know. But usually there's some kind of, or often I should say, there's a vice chair of faculty development, and there are people who are around the vice chair level in their department, or maybe they're further along and they're involved in helping one review their resume as they try to anticipate the promotion cycle where every few years you go from clinical instructor to assistant to associate to full professor. UCLA has a great system within the Department of Anesthesia for that. And a lot of departments, in addition to having meetings that are for the whole department, very transparent, there's also the opportunity to have a faculty mentor who's at least 1 or 2 steps ahead in that promotion ladder, who can really review your interests and connect you, especially if you're newer to the institution. Maybe you don't know the ins and outs, to figure out how to contribute to the university within the department, but also extramurally, teaching opportunities, leadership opportunities, committees that you could get involved in inside and beyond your department. And from what I know of private practice, I mean, there's so many different models, but I've heard a lot of great things about similar structures, but within the private practice model. And I think it is one of the drivers of certainly my professional sense of well-being, that you feel like you have people at work. So I think it is, like you were saying, really important. And it's something that a lot of practices strive to create, whether they're academic or private.
Yeah, that's so true. And I mean, you said it, gives you a sense of trust and well-being within your own department, which is a second home for all of us, right? It's our second family. So that's great. And before we wrap up, I know we've said it a couple of times, but I just want you to have an opportunity here to specifically direct listeners on how to get more involved. What's the process? What should they expect? And then how they can stay abreast of what's happening with the program.
Sure. Well, the way to get involved in the ASA mentoring program is simply to log into the ASA website, and that'll give you access to fill out all the forms. When you go to asahq.org/mentoring, the profile information you select, the things that you select as self-identifiers, there are so many different domains to check boxes in. This is completely independent of your general ASA profile, which is also something that you create elsewhere within the ASA website. So the only people who will see this would be, if you're signing up as a mentor or a mentee, would be people who are finding you through the mentorship directory. It's not like the general ASA directory. So you can get really specific, and it's not like this is just going to go on the web for everybody to see. It's only people who are interested in mentorship. And once you go to that website, it's pretty simple. There's a getting started and an enroll tab. You can enroll as both a mentor and a mentee, depending on your career level and what you're interested in doing. And then you can use the directories tab to find a mentor or a mentee. And this is really meant for everyone. And it's at any point in a mentoring relationship where you've defined the time frame and what you want. If you as a mentoring pair feel like it's time to move on, especially, for instance, if a mentee wants to find another mentor, you're welcome to move on at whatever point is useful for you. But the feedback that we've gotten from participants, especially mentees, but also mentors, has been really outstanding. And we want to build awareness. We want you to tell your friends and just have as many people sign up as possible to build up the strength of the program.
And Dr. Henke, how can listeners stay abreast of what's happening with the program?
Number one, once you sign up as a mentor or mentee, you're going to get emails when people are seeking to connect. But we also want everyone to be on the lookout for updates based on feedback from participants, because the program is continually integrating this feedback. And our next steps, we're really looking to help ASA committees and executive leadership members connect with mentees who are interested in getting more involved with the ASA and learning what that means, because the ASA really wants to open up and bring as many people who are interested as possible.
Yeah, that's so great. And thank you, Dr. Henke, for all you're doing for this specialty for us and the work you're doing to strengthen mentorship and wellness across anesthesiology. This conversation, I think, underscores that mentorship just isn't about career advancement. It's about sustainability, connection with people, taking care of one another in this profession. And thank you so much again for joining us. This was such a great chat about this topic, and I'm also very passionate about mentorship. It's a topic that so many anesthesiologists care about and can relate to. So as a reminder to all of our listeners, you can learn more at www.asahq.org/mentoring, mentoring, and come back soon for more Central Line. Thank you.
Whether you're looking to be a mentor to share what you've learned and help a colleague, or you need guidance and support from a peer who has been there and done that, the ASA Mentoring Program provides an on-demand mentoring relationship so you achieve your personal and professional goals. Explore details and sign up now at asahq.org/mentoring. Subscribe to Central Line today, wherever you get your podcasts, or visit asahq.org/podcasts for more.